It's huge. I mean, it's a whole different world. Because, and then they say, well, the willpower thing, you have to have more willpower. Well, maybe so. I can use all my willpower all day long to fight this, or I can be treated for my disease and use my willpower for something more useful.
Welcome back to the Obesity Stories Show. I'm your host, Dr. Dan. Now, a lot of you reached out and told me how much you loved our first episode with Kendra. Today, we've got our second episode with Rob. Now, Rob has had a lifelong struggle with obesity, but his obesity really didn't become an issue until he immigrated to the US of A and started to engage with the SAD, or the Standard American Diet. From there, Rob saw his weight go up, and unfortunately, he started to develop a number of health complications. And he really didn't get much support from his primary care provider, short of just eat less and move more. And it wasn't until he found an actual obesity specialist that was able to support him, to tell him about what he's dealing with, and actually prescribe him a GLP-1 based medication to help him start managing his condition. Since then, Rob has taken control of his health, he has lost a significant amount of weight, and he has corrected a number of those health complications that he was dealing with. I really enjoyed this discussion with Rob. He has certainly got the real life lived experience, in particular, just how detrimental the SAD, or Standard American Diet, can be. He also really highlights how eating less and moving more is not the magical ticket to weight loss. His is another journey that really shows obesity is a chronic disease, and it is something that can now be managed with the proper treatment and support. Now, if you haven't already done so, you for sure need to subscribe to my channel down below and turn on those notifications so that you never miss out on the obesity stories or any other content that I put out. Plus, it'll help me to feel really good about myself, and of course, I really appreciate the ongoing support. And if you are interested in sharing your story, check out the link down below, fill out the questionnaire, and our team will reach out to see about bringing you on the show. And without further ado, let's talk to Rob. Rob, welcome to the show. I am very excited to have you here today and to hear you share your story. It's very unique in a number of senses. And yeah, how are you doing today?
Doing very well. Thanks for having me on the show. Looking forward
Absolutely.
to it. Yes.
Awesome. Okay, Rob. Well, let's cut right to it. Let's dive right in.
All right.
Tell me a little bit about your history with obesity. What's kind of the rundown on your story, if you will.
Okay. Well, earlier in my life, it wasn't a huge deal. I was always slightly overweight, but then I was able to control that pretty much. And then when I went to college, the pounds started adding up a little bit more, but still not more than overweight. I never got into the obese category.
Right.
Then we moved to the States, and within about a year and a half or so, I ballooned. Like I went from 180 to 240. So
Okay.
about 60-pound gain in about 2 years' time.
2 years
And
time.
yeah, so it was quite something else. And I was trying to fight it. I was exercising. I went to the gym,
Mhm.
and then on the way back from the gym, went to McDonald's, of course, and because I was hungry as heck.
Mhm.
So I was fighting a losing battle there. I mean, and I would lose 20 pounds, and I would gain 20 pounds. Then I went on a keto diet, or at that time it was low carb. Keto wasn't the thing yet.
Right.
Low carb, of course, and then that worked for a while. Oh, I lost, and then there was a South Beach diet. All kinds of diets I did, and it went up and down and up and down. Never really got to my goal weight on any of them, but some substantial weight loss
Okay.
on some of them. And then in the meantime, blood pressure's going up, A1C is going up. Every doctor's visit was like, okay, yeah, next time you'll probably be diabetic. This is an inevitable path you're on.
Right.
And they didn't suggest anything beyond, just eat less, and move more. And I'm moving and not eating less, apparently, because my body was fighting this somehow. So yeah, that's the picture of how I got to the obesity.
Okay. So really, you were away. You weren't living in the United States at that point in time, and then like you said, you gained the freshman 15 really,
Yep,
and we're doing okay, kind of managing. But it really wasn't until you made that shift to the United States and started
correct.
partaking in the standard American diet, if you will,
Yes.
And yeah, I mean that is certainly the downfall for a lot of people, and really where I think a lot of the food industrialization and engineering of food to make it as
without a doubt.
delicious and tasty as possible. Um, yeah, so it kind of was over a 2 year period. You gained a
Yeah.
substantial amount, eh?
Yes. And
Okay.
yeah, as I said, the obesogenic environment, that was the thing that really triggered it for me. But I mean, I did have a bit of a guilt trip with that because, uh, I'm too weak to resist that environment. What's going on? And I'm going to just go to the gym more. And it just didn't help. I mean, the exercise was great, of course, for other reasons than the weight situation.
Yeah.
But it didn't do much for my weight.
And
I
it
mean, I did pack on some muscle here and there, but other than that, the weight just kept creeping up.
Well, and I mean that is par for the course in that exercise isn't actually recommended as a weight loss modality because it's not that effective. Like it is great for your health. It can help with your blood pressure, cholesterol, all that good stuff, and it does to a degree sensitize your brain to the satiety hormones and even the medications like the GLP-1 receptor agonists and such, but exercise is limited because you have to do so much of it to get any kind of weight loss benefit. But in the course of that, your body is going to adapt and prevent all kinds of ways from you to prevent you from losing weight. It's going to make you lazier. It's going to make sure that your appetite goes up. Stopping at McDonald's maybe afterwards, and so on and so forth. So I mean, you're very much kind of the did the exercise, did all the diets, doctors telling you we gotta get your health under control, and you're kind of on this trajectory. I guess where was a turning point? What kind of occurred next for you?
Well, my health started deteriorating. I mean, I was born with only one kidney, so there was another factor there, and my blood pressure. There's a hereditary high blood pressure situation on my mother's side of the family. She had her whole life, and her sisters all had high blood pressure, and I had always had higher blood pressure, and it kept going up. So my kidney function started to decline, and to the point, at some point, the doctor said, "Well, I don't know if I need to do a biopsy on you or something. This is not good." So, and this was before the blood pressure was treated. So he put me on blood pressure medication, and then 3 months after that, luckily, a lot of that function came back. So I guess it was an acute damage or something. It was not a long term thing. So the blood pressure medication helped recover some of that, but overall, it still was not great. So A1C was creeping up, LDL-C was going up. My triglycerides were nuts. They were 700 at some point. So, so I mean, and so they put me on the blood pressure medication, but they never did anything on the lipid side of things until a few years ago, really. Um, so yeah,
Okay,
uh,
so it
that's where
it
that is.
it started like creeping up on you and such, and then your journey kind of yeah you eventually got onto the GLP-1 medications. Where did that kind of happen along the journey here?
Yeah, that was in 2022. I was more on Twitter and going on some forums, and I bumped into a couple of obesity specialists, and they were talking about, well, this phase 3 trial of tirzepatide is really mind blowing. A lot of is happening there, and so I'm starting looking into that. And I thought, well, diabetes. I'm not diabetic yet, but maybe let's see. Oh, it was originally designed for diabetes. Or interesting. So I started looking into that, and then the combination of, well, I'm pre-diabetic, I'm obese, I have obesity,
Mhm.
this could be something. So I started chatting with one of these doctors, and he says, I think you're a candidate. So then through a telehealth setup, because my primary care provider, when I mentioned it to them at the time,
Yeah.
they were not. They said, no, it's not. No, you don't need to be on that. You just need to eat less and move more. Well, I've been trying it all my life, sir.
Yeah. Oh, geez. Yeah, we're working on that. That has been the
Yeah.
gold standard we've been following up to this point, but clearly that's not working. And that was in, yeah, you said 2022, eh?
2022. So when Mounjaro came out with the coupon, that's when I
Right.
was able to get on there because the telehealth doctor said, "Look, I can write you the prescription if your doctor doesn't move, I can prescribe it for you. Get on this. We'll guide you through this, titrate you up, and see how you do.
Right.
Well, it was like immediate. I mean, within I mean, I took the drug. I mean, on the same day, the appetite just was turned off. Like and that was on a 2.5 milligram dose. It was like the starter dose.
Right.
It was almost immediate, and I lost 10 pounds in the first month.
Okay.
And every month they titrated me up to the next dose. So I did end up on the highest dose, 15 milligrams,
Right. Right. Wow.
eventually. So yeah, that's how
So,
I got in there.
so I mean, yeah, that's right out the gate. You noticed it, like within the first
Oh,
day and the first month, you're already starting to drop weight at that point.
oh yes. And
Wow.
now my he also put me on a low dose statin and ezetimibe for my LDL.
Right.
So within when I did my follow up blood work, it was 6 weeks later or so.
Mhm.
All my values, so my A1C was 5.1, went from 6.1 to 5.1. My LDLC dropped from 105 to 35. And
Okay.
ApoB, I said, well, you also got to check your ApoB because sometimes there's a discordance, especially with your high triglycerides. There could be some issue there. And
Yeah.
sure enough, my ApoB was a little higher, was 40. Well, the ApoB was 116
Okay.
and it went to 43.
Damn. Okay. So,
So, so I went on Mounjaro and the statin and the ezetimibe at the same time. So it was a little hard to sometimes figure out which is what. Well, we know which medicine treats what, so it's not that hard. But there was
but
that confounding factor that I got on these medications at the same time.
absolutely. And I mean, yes, losing weight and being on the GLP-1s, like we do see improvements in lipid lowering. So it does reduce LDL, the triglycerides and that sort, but the amount that we would get, it isn't comparable to what we see with the statin medications. And for a lot of
Right,
people, their cholesterol is genetically driven. Like you're just
right,
this is what you get from mom and dad. You can't do anything about it, even in some cases with the perfect lifestyle you
right.
can try to, but yeah, there still is that component where it could be higher. So it sounds like you found a really good combination. And are you still on the Mounjaro at this point,
Yep,
or
15 milligrams. And that was the thing because I'm reading on these forums, people are starting to wean off and say, well, I'm trying to get off Mounjaro or Zepbound or I'm titrating down. And I said, well, I want to find the minimum effective dose. I'm not out to be on the maximum dose. But when I tried that, immediately, well, within a week or so, I noticed weight starting to creep up.
okay?
So I'm staying at that dose. And even at 15 milligrams, if I travel
Mhm.
or if I go into in a super enticing environment, I still gain a few pounds here and there. They disappear quickly after I go back into my controlled environment.
Right.
But it's like really, I have to I have to be on that high of a dose to even maintain. That was a little disappointing. I had hoped I would be able to go to a lower dose. On the
I,
plus side, I don't have any side effects to speak of on that high dose, so I guess it's not a huge deal.
yeah, did you have like any side effects out the gate at all?
Yes, in the beginning, it was pretty severe constipation,
Okay. Okay.
and a little. The nausea wasn't as bad. There was some nausea, especially just after the injection, the first few days, and
Okay.
during the up titration, there was some of that. But right now, there's basically none. I take Miralax once a week just in case, and that's everything's good.
Okay, so you found that nice balance that
Yeah.
keeps you going, keeps the pipes nice and clean,
Yep.
and yeah, you're on that higher dose. So it's interesting because yeah, you got such an immediate response out the gate. So very much you were sensitive to the drug. It started affecting your appetite. Got a good response overall, and you've certainly noticed, even at the top dose, like you really can't move down from that because
No.
your brain starts sending out those signals and saying like, yeah, you've
Okay. Well, I can no longer close that bag of chips. I mean, that was one of the most beautiful things. Like, I take a bag of chips and I take like 3 or 4 bites and I'm done.
okay.
Previously, I wouldn't stop until the bag was empty. Like, they
And
just kept going. And
did
now
you
it's like there's an off switch.
wow, did you feel like it was like almost a compulsion beforehand?
Yes,
Like I have to finish it and almost losing a little bit of
absolutely.
control?
it was like a binging type deal. Like I have to keep going, and then I would close the bag, put it away, and then 30 seconds. No, I need some more. I just couldn't resist it, and now it's just very easy.
No kidding, eh?
Just,
Okay.
I can, and that's the other beauty of this drug. It's not like you have a dietary restriction. I have to do this. I have to be low carb or high carb or this, that, or the other. I can eat pretty much everything within, but it's self limiting. It's like, okay, you can you're done now. You've had a little bit of the good stuff, and you feel full.
Right, right. So you have much more of that mindfulness piece, really kind of you're making that more cognitive choice of, yeah, I am full, I feel that signal, and I'm going to
Yep,
stop eating
and,
now.
and I can put it away, no problem.
That is amazing. Like you are a classic example of how these medications can make such a big difference and the effect that they can have for somebody and really quite a profound effect in your case of it.
Yeah,
So
and
in oh,
now there was another interesting thing is when the coupon ended, I lost access to the medication because my insurance wouldn't pay for it. And there was a prior authorization, and they said no, no can do. So I was off for about 6 weeks, and I gained 8 pounds in that period. Then they started covering Saxenda. That did nothing. It's like sugar water. It's like or what is it? Saline solution. It had no effect. I just keep going up. So and then thankfully, suddenly I got on my insurance. Hey, no longer prior authorization needed for this for Mounjaro. Oh, okay. So immediately back to the doctor, put the prescription in, and yep, I could get it again. So that was fortunate. But we don't know how long that's going to last with the shortages and the insurance companies cracking down on the use of it. So who knows?
well, and that's a big worry that's coming up for a lot of people, especially with some of the big providers like Blue Cross. They're taking it off of their formulary and saying they're not going to
Yeah,
cover it anymore. And it's like,
yeah,
I get that these medications are a big cost, and I mean we could have a whole conversation about the insurance providers. People get on the drug companies and say they're the bad guys, but it's
no,
really the insurance companies that are driving some of these prices and costs. But
no.
it's very unfortunate because it for people like you, it is a dramatic and life changing
Oh,
difference.
it's huge. It's I mean it's a whole different world because and then they say, well, the willpower thing. You have to have more willpower. Well, maybe so. I can use all my willpower all day long to fight this, or I can be treated for my disease and use my willpower for something more useful. You know.
Absolutely.
So
No, that is the big key there, that this obesity isn't something that you can just wish and will away or anything. Like it is a chronic disease that requires management. Lifestyle is a key pillar in managing it, but we have
definitely,
medications, we have bariatric surgery, like there's so much that goes into it and are needed to kind of come together to get the most effective treatment for whichever individual that's sitting in front of us. So I'm so glad to hear that it's working so well for you. What are some of the other behaviors and things that you're engaging in on a day-to-day basis? Like you said, your controlled environment. What does your controlled environment look like?
I work from home, so it's very easy then to set up a regimen. Like, okay, this is my breakfast, and this is my coffee break, and this is that and the other. I'm not putting. There's not a lot of temptations out there to start snacking because I have more control over that. Exercise hasn't really changed that much since before I started because I was walking, I was doing strength exercises and things like that. So that's continued. So they are now more effective because I'm not trying to negate that the effects of that with overeating.
Right. Okay.
And also, the other thing that was really important in the beginning of the journey is to have access to an obesity specialist like yourself, who guides you about well what you're going to expect and setting expectations and also making sure to realize that you're going to not only lose fat, you're going to lose muscle mass or lean mass, and you're going to have to mitigate some of that with make sure you have enough protein and strength exercises and all that good stuff. So because you're not now you're seeing a lot. I mean, I've got friends who don't have access to the medication to their insurance, and they say, well, there's a spa around the corner, and they're prescribing this compounded stuff. I'm going to go that direction.
Mhm.
Okay, it's easy for me to say to them, yeah, don't do that because I've got the access. So if I were in their position, I don't know, I may go that route too. But it's such an unfortunate situation because you don't know necessarily what's in those compounded drugs, and there's no guidance. They just prescribe it. And I had one friend, he got it, didn't want to take it, left it in his refrigerator for a month, and then took the whole vial because it was in a vial with a needle, and then he almost ended up in the emergency room because it's like, dude, you can't just randomly yank this stuff off the shelf and go for it. This needs to be in a guided situation with a specialist.
And I think that's such a key point. And, having that obesity specialist, like there's so much education that I provide to patients just, yeah, with expectations. Like if you come off the drug or if you take too much, like these things are going to happen. And that's why we need to take it nice and slow to increase your dose over time so that you can adapt and get used to it. The constipation, the diarrhea, those kinds of things become more manageable for you. And we find the tweaks, like you found Miralax, like, oh, I just got to take it once a week, keeps things going. And you need to have that support to be able to kind of work through that. And unfortunately, yeah, with these spas that are kind of popping up, I've created videos and content around that, and a lot of people have been like flat out upset at me of like, they're well, that's all we have access to. And it's a precarious balance. Like you said, it's a very unfortunate situation that it's not covered by a lot of insurance providers, and then we have all of these shortages that are going on. But again, we got to look at what is the best outcome for the individual, and taking something that you don't know what's in it. There's been a lot of issues coming up with these compounded medications. These spas, do they actually have your best interest in mind? So if we're looking at like health as being our ultimate goal here, does that actually mean health, or are we just so desperate to try and lose weight that we're willing to put anything and do anything? And I mean, if we look over time with the various compounds that have come out and are still available even on the black market, people are using some very, very dangerous modalities to try and lose weight because of the messed up perception that we've created of like you have to look a certain way and be a certain way and that sort of thing.
Well, and on speaking to that point, because I did lose a lot of fat in my face, so people are going, dude, are you sick? Just, no, I'm actually much healthier. I look like my grandpa. I give you that, but I feel great.
Right. Well, and I guess, yeah, taking that a little bit further for you, what are the health things? What's the biggest, I guess, breakthroughs and things that you've noted since you've reached kind of your goal weight and you've been engaging with the medication and that sort?
Well, I had to reduce all my other medications. I've had to cut my blood pressure medication in half. I was getting dizzy and going, whoa, what's going on? So I checked my blood pressure and it was like 100 over 55 or something,
Wow.
which I guess for some people is normal, but not for me because I know it was a little on the low. So I couldn't believe the numbers. So I had to back off my blood pressure medication. I'm still using some because there is that genetic element. I've never been completely off of it. In spite of the good weight loss, it's definitely improved.
Yeah.
Also, I have psoriasis and it's non-existent now. It's like the symptoms of those are, I mean, I'm sure I still have it, but I, it's like 99% gone. I went to the dermatologist and they go, dude, if this was your first visit, you would not be diagnosed with any of this. You basically don't have it right now.
No
So
kidding.
that was an interesting side effect.
And that's something we've seen as well with these medications. I think it's twofold. One, having extra fat tissue on the body certainly can increase the inflammation in the body, but these medications, separate from helping you to lose weight, can reduce the inflammation in the body, which psoriasis very much is an inflammatory based condition,
Hmm.
and it manifests on the skin. So I'm not necessarily surprised by it. I would love to know more about the mechanism, but there's all
Yeah.
kinds of cool things that are coming out with these medications.
And I mean, I was never a big drinker to begin with, but since Mounjaro, I have like zero appetite for to the point of, I'm skipping this. Not that I'm against it. It's just I don't, you know, don't have a need for it.
Oh, totally. Yeah, and it doesn't. I find a lot of people even say, as you change your weight, as you change your lifestyle and behaviors, you do take on a new identity, and whether it's the medication, like I just don't need it, and you can be, you do you, whatever. But some
Yeah,
people just say like I don't want to drink anymore. Either
yeah,
A, I don't feel like it, or B, it's just not part of the lifestyle that I'm creating. And to be honest, like myself, when I drink it, I feel horrible, and I'm like,
yeah. That's what ended up happening. I took a drink and then I don't like the feeling anymore. Well, why would I do this? So, no thanks.
absolutely. So, all right, awesome, Rob. So you're currently at your goal weight, if you will.
Yes.
What does the future look like for you? What are you hoping to do, hoping to accomplish? Yeah, what does that all look like?
Well, it's a bit uncharted waters, I think, because I think we're outside of the period where the studies went to see how long the weight loss would be maintained. So I'm curious to find out, will this 15 milligrams be enough for the rest of my life, or to keep me there, or for as long as I need it? Or is it going to creep back up? That's one concern. I don't know. At the moment, we're great. And so one of my goals is to try to keep access to these medications, although that's a lot of it is outside of our control. Just hoping that that the insurance will keep covering it, and that the pharmaceutical companies get the supply issue resolved. So yeah,
Absolutely. Okay, fair
in,
enough.
in the meantime, continuing trying to maintain healthy lifestyle habits and exercise. And as all another fun side effect there, most of my family and friends, they were very skeptical. They said, "Dude, well, you don't need to. You're on a medication for this. And you shouldn't be on this." And now five of them are on it because they have finally realized the story. Like, okay, yeah, this is not a willpower thing. It's the disease thing, and we have now five family members on tirzepatide, and very happy about it.
Well, and we know there's again the disease aspect. It's hugely genetic. So, and the fact that you've responded to it, very good chance that your family members are also going to respond
Yeah,
and have a good effect with it. So, again, genetics is going to come into play. You probably all grew up in somewhat of a similar environment if you all came from the same country, and probably when you all came to the States, experienced a similar gain in weight that
yeah,
occurred when you got here.
that's exactly right.
Cool.
My son is a prime example, and he's now also reaping the benefit.
That is awesome. I mean, I'm glad to hear it, Rob, and certainly taking the aspect where you've done the diets, you did the willpower, you fought tooth and nail, and having the doctor just say, yeah, you need to eat less and move more, but then actually getting this treatment and managing the condition appropriately with all the lifestyle behavior, exercise, and that sort. You're a prime example of what can occur and how effective these medications can be, and certainly the positive effects. Your lifelong goals and looking at, yeah, maintaining the weight, what's that going to look like? And we certainly don't have all of the long-term data from a safety perspective. I think we're looking pretty good. We have plenty of experience, but yeah, that long-term maintaining the weight loss, how is that going to go about? I mean, I think they just had an extension of the select trial or post hoc analysis where people were 4 years out on the drug and they're maintaining the weight. So it's looking very positive in that sense. And I mean, with like hypertension and other conditions, as you progress through life, your blood pressure might go up just because your arteries are less flexible, and that's part of that aging process. For as we get older as well, we start to lose muscle mass, so it gets harder to maintain our weight. So there certainly could be some amount of weight gain, but continuing to engage in the positive behaviors and doing all the good things that you're currently doing are going to help to mitigate future risks and certainly keep more weight from coming back on, if you will.
For sure. And another thing that did concern me when I started was the black box warning on the thyroid cancer. So, and then luckily, when I spoke to the doctor about it, he said, that was in mice, in rodents. And sure, it's something we need to watch for, but we're not seeing it in clinical practice. And human thyroids don't have the same GLP-1 receptor setup as rodents have. That's what I understood. So that made the concern go away. But then within a month or so, I got a funny thing in my throat where a weird swallowing noise. So I'm going, oh no, I got thyroid cancer. So I went to the doctor. Turns out it had nothing to. There was some deformity in my neck, which I inherited from my dad. He had the same thing. When you swallow, there's some bone spur activity or something. I forget exactly what it was, but there was some bone protruding a little bit into the throat, which caused that, and had nothing to do with tirzepatide. But it was a concern because those things happen at the same time, and go, oh no, here we go. So,
Yeah, yeah, a little bit of a scare there to really put you on your heels and like, oh my God, I've made a mistake. Like,
yeah,
and
like
that's the first
oh
place that we go to. And of course, our the same brain that gets us to eat all those delicious foods causes all this illogical, irrational response to
yep.
immediately jump to cancer versus
Oh
being like,
yes, always
oh
go
yeah,
to the
worst case scenario, right? So um, awesome. No, Rob, it's been an absolute pleasure, and I really appreciate you sharing your story with me here. Is there anything else that you wanted to add or to really highlight about your journey, or anything else that you want to share with our
well,
followers?
other than people that who starting this journey, realize that this is a disease. It's not your fault, no matter what people keep saying or what the health gurus try to tell you or put you on some diet they want you to pay some money for. Forget about that. It's a disease. Go in there, find an obesity specialist like yourself, and get educated on this thing, and learn the difference between outcome data from studies versus mechanistic speculation and wild stories from people that are trying to fearmonger you to death. So stay on the right path there. Get the right information, get support, and try to get treatment.
Awesome. I think that gives a beautiful little summary, Rob, and really ties it all together about, I think, the importance of what these medications can do, but you need to have the right information to make an informed decision that it's going to work for you. And that's finding the right specialists, the right individuals online. So everybody should subscribe to my channel
Definitely.
and keep checking in and making sure that you're on the right path and bad things aren't happening or coming up. And if you are getting side effects, go and talk to your doctor. Please do
Yeah,
not sit at home and message on a forum on Facebook, what do I do? That is not the right approach at all. So
exactly. 100%.
awesome. Again, Rob, thank you very much for taking the time to speak with me today and for sharing your story. I think it's very insightful, very important, and is a really great example of just how amazing and effective these medications can be, and really highlights, well, what the whole purpose of these podcast stories are for, in showing that obesity is indeed a chronic disease and it's not an individual's fault. So thank you for
Exactly.
coming on. I appreciate it.
My pleasure. Thank you for having me.